Hi, everyone. It's Dr. Azi here. Welcome to the More Than a Pretty Face podcast. Hi there, Dr. Deepak
Hi.
Dugar. It's so nice to meet you on Zoom. I've heard so much about you, and I'm hearing that you have a best-selling book called Beautiful. Is that right?
Yes. Yeah, beautiful. And so, we just spelled it special, but it's just beautiful. The whole concept of the book is just to unleash your actual inner confidence in who you are naturally. We live in such a social media plagued world where we're all so hyper focused on looking like someone else instead of appreciating who we already are.
I love that. Well, I want to hear more, but before we get started, guys, Dr. Dugar is a board certified rhinoplasty surgeon, and he's going to give us some insight, not only about nose jobs, but about just general his practice and his outlook on seeing patients. And I have so many questions for you because nose jobs are such a hot topic. There's so many questions that everybody has about it. But before we get started, tell us a little bit about your background.
Yeah,
what you
sure,
do.
sure. Yeah, well, thank you for having me on the show. I'm a big fan of yours. You have a huge following and you do some amazing work, and it's an honor to talk to you today. So happy to be here. And so I grew up in Texas. I'm originally from Canada. I grew up in Texas. I went to a combined medical program in DC, a 7-year med program at GW in George Washington, in Washington, DC. It's actually where I met my wife there in high school at our interview for this program, and we are still together until today.
Oh my God.
Yeah, we just did a nose together. We have 3 more to do today. So we work together.
Wait.
She's my anesthesiologist.
She's your anesthesiologist?
Yeah.
Oh my
Yes,
God, I
yeah.
love that.
I know one of them. I have a few, but she's one of my anesthesiologists. And we were in DC. Then I did my training in ENT facial plastic surgery in North Carolina, Chapel Hill, and then did a fellowship in Los Angeles with Dr. Raj Kanodia, who's one of the kings of the world.
Yes, he is. How was that?
It was amazing. He's amazing. I mean, he's one of the best teachers in the world, one of the best. He's my teacher, my mentor, my guru, I would call him. And pretty much everything I learned from him. And Dr. Pastoric in New York, Norman Pastoric's another one of my good mentors as well. And I kind of did a fusion style where I took a lot of my mentors' teachings and put them together to find the path for me. And I ended up joining Dr. Kanodia's practice and creating my own practice in his infrastructure. And today we're partners and own a surgery center and have this giant practice together. And
my gosh, I didn't know that.
It's been a journey. Yeah.
Wow,
it's been a journey.
what a journey. I love that. I love your approach of taking what everybody has taught you, all your mentors, and forming your own unique recipe.
Yes.
That really does resonate with me. I think as physicians, it's so important to have good mentors and good teachers like you've had.
Yeah.
So you've had some really good training. It sounds like. Congrats. That's awesome.
Yeah.
So I want to jump in now.
Sure.
I've heard that and I want to know if it's true, that your practice turns patients away when they come in to see me. Tell me about that. Like, how do you do that? I haven't heard of plastic surgeons turning people away.
Yeah, well, my practice is a little different. I'm a niche specialty because I only specialize surgically in closed Scarless Rhinoplasty. So I don't do the whole quadrante of surgeries. I don't do facelifts or eyelids or lipo or boobs or butts. I just do noses. And within noses, I only do closed Scarless Rhinoplasty. So mine's a very niche practice that I developed. And I love it because I have patients from all over the world. They fly in. I mean, today alone, we have a patient from Stockholm, Switzerland, one from Washington, D.C., one from San Juan, Puerto Rico, and one from India. Gujarat, India are my 4 patients today. So people come from all over the world because of the niche that I do. Because of that, though, it's also the patient has to be qualified for this type of procedure. And so I have a very rigid, stringent qualification system that I choose patients within. One of them is whether they need surgery at all or not. And that's the biggest filter that I have to put them through to make sure that they actually qualify. A lot of people are way better looking than they think. They have better noses than they think. They don't really have an issue anatomically that can be cured. Even if they have one mentally, they don't have one that I can cure anatomically. So I got to put them through that filter and make sure that they make it through step 1, which is, do they actually have an issue? And then step 2 is whether or not the issue can be fixed with my approach, or do they need a more complicated surgery, such as an open rhinoplasty, where there's a more reconstructive mentality. So if either of those don't match the criteria, then I have to be honest. My whole thing is we're here to help people. We're a business second, we're physicians first, we're healers.
Absolutely.
And, helping the patient and making sure we're doing the right thing for them. Do no harm is my number one thing.
Absolutely. I agree. We are profession. We are a profession. We are not a business. So tell me about scarless rhinoplasty. How is that possible? Is that like magic? Like, how can you not have a scar?
Yeah. So it's funny because scarless rhinoplasty was actually the preferred method for almost 100 years. And then about 30, 40 years ago, open rhinoplasty really took over most of the United States. So closed rhinoplasty is also known as endonasal. It means all the incisions are made inside the nose. 50 years ago, every single major surgeon in the entire world did closed rhinoplasty. And you can actually study this from Jacques Joseph, who's one of the founding fathers of rhinoplasty, who then taught Dr. Diamond in New York City, who in their 30s, 40s, and 50s was the king of rhinoplasty. They used to call him the nose job factory. And then Dr. Diamond trained people in the likes of Eugene Tardy, who was one of the kings and masters in Chicago. And Dr. Tardy trained Dr. Raj Kanodia. Dr. Kanodia trained me, right? So it's a legacy. You can actually map it. Most rhinoplasty surgeons, like most crafts, you have mentorship legacies. And so closed rhinoplasty was all that anyone did. And then about 40 years ago, open rhinoplasty became very popularized. This group of surgeons in Dallas and another group of surgeons in Toronto, they made it very popularized because it's so much easier to teach. Open rhinoplasty, you make a cut at the bottom, lift up the hood of the nose. So you can imagine, you can see the whole structure.
Oh my gosh, yes.
6 or 7 students can all learn at one time.
Yes.
You're able to teach so much better. So academically, all the academic institutions lean towards open rhinoplasty. So today, most academic institutions around the entire country only teach open rhinoplasty. If you want to learn closed endonasal rhinoplasty, you have to go find a mentor who does it on a regular basis. And there's very few of us left. So that's the reason I kind of chose it. I kind of like reviving a dying craft almost. I think pendulums, like everything in our careers, we see like, Brazilian butt lifts 10 years ago, it was all about how big you can go. Now it's about how petite you can make it and how subtle you can do it. We're seeing the reverse, even in Kim Kardashian and Khloe Kardashian, you see their bodies, see them walking around. It's a different look today than it was 5 years ago. So I think noses are on a pendulum too. And I think we went through the era of overly done nose jobs, really scooped, really turned up. And even today, we're still in the middle of that pendulum. Turkey has become this huge discussion point for nose jobs. A lot of surgeons are saying the best surgeons for nose jobs in the world are in Turkey. But if you look at the results, they're very surgical, in my opinion. There's nothing wrong with it. I think some people like that look, but I think that in my practice, closed rhinoplasty is more about subtlety, more natural. It's more like a nose you could have been born with. And that's the biggest compliment I get from my patients is they tell me postoperatively, Doc, I feel more like myself now than I did before surgery. And that to me is the biggest compliment. So that's why we do closed rhinoplasty, all internal cuts, is because we're just trying to refine.
Hi everyone, it's Dr. Azi. With the holidays quickly approaching, what better time to start renewing your skin so you can put your best face forward at all the upcoming get-togethers. AziMD Skincare is offering 20% off our Lift and Renew serum to our podcast listeners only. Clinical studies show similar efficacy to prescription Retin-A, but without the irritation. It combines trans-retinol and a slow-release technology with bakuchiol and antioxidants, making it a powerful, science-backed anti-aging night serum. Lift and Renew is a multitasking serum to renew skin cells, improve skin texture, pores, fine lines, and discoloration for a brighter complexion. Take 20% off Lift and Renew serum at checkout on AziMDSkincare.com with code October20. I love to see your skincare transformations, so tag me in your posts on Instagram at Skin by Dr. Azi. So tell me, what to you as an expert in rhinoplasty, what's the best nose job? Like, how do you tell somebody has the best nose job?
It's the one you can't tell.
Is the one you can't tell. Okay. But is there, do you look for proportions or do you look for, a certain angle, a certain width or height? No. Just the one that goes undetected.
Yeah. The example I give is, have you ever picked up a beautiful flower? And have you ever started to talk about the angles of the flower and why the flower is beautiful because it has a 30-degree angle between the petals? No. Usually you just look at a flower and you appreciate its natural beauty organically And that's what makes you feel beautiful about the flower. And so it's the same thing with beauty and faces. A lot of plastic surgeons, I love them, God bless my field, but a lot of them are dorks. And a lot of them don't have any concept of beauty. They're dorks, and they don't have any concept of beauty, unfortunately. So they study the textbooks and they study 30-degree angles, and the nasolabial relationship should be 24 degrees. If it's 23, that's wrong. And they have all these protractors, and it's unnecessary in my opinion. I think if you understand beauty and you appreciate true beauty, you're trying to just pull out that inner sense of what the patient needs to feel more beautiful and look more beautiful. It's just like the flower analogy. You don't study the angles of the geometry between the petals. You just appreciate the beauty of it.
So really, it's an art. This is where science meets an art, and
definitely.
And it sounds like you've got it down. So, a lot of people, and I do this in my practice, come in for liquid rhinoplasty, which is where we use fillers to, sculpt the nose or mask a hump or lift the tip. What do you think about that? Does that affect what you do when somebody comes in and they've had filler in their nose? Does it make things? Yeah.
Great question. So I will say a lot of liquid rhinoplasty is done beautifully, superb. I see a lot of patients with a really subtle liquid rhinoplasty from someone like yourself, someone really skilled, and it looks fantastic. And then I will say there are the smaller percentage of patients who have a terribly done liquid rhinoplasty. And I would say the qualifications to me of a terribly done liquid rhinoplasty is when they try to overfill it. It's not understanding the boundaries of what liquid rhinoplasty is. So I think there's this concept that some people have that every nose can be done with a liquid rhinoplasty. And that's just not true. Someone who has a really big dorsal hump, you can't really fill that with a liquid rhinoplasty because the problem is you have to put so much filler from the lateral view, the side profile view, in order to make it look flat. But from the front, you start to get lateral spreading in between the glabella region, which makes it look almost like avatarish or alienish. And I see so many of these patients who come in with that, and it looks really bizarre. And I'll give you a recent example just happened. I had this beautiful young patient, 24-year-old, gorgeous young girl who had a liquid rhinoplasty by a really well-known physician and overly done, way too much filler. And so she came to me and said, hey, listen, I'm tired of doing the filler thing. I want to do something different. And I actually love filler for patients to try out their, to see if they're even a candidate or like it. And sometimes I tell them just keep doing the filler because it looks so good on certain patients. But this patient particularly, too much filler, wanted to get it dissolved, wanted to get real surgery. I said, great, let's do it. Go get it dissolved, come back. In the process of getting it dissolved, because there was so much filler, they caused a lot of trauma. Some of the filler ended up going in a blood vessel by accident, and it ended up necrosing an entire 3-centimeter hole in her septum. So she has this septum. Wow. Yes, a giant hole in the middle of her septum. And here's the best part. I was asking the provider, the doctor who did it, what was her septal exam beforehand? What did you see in the septum beforehand? Oh, we never looked at the septum. So you're injecting into a space that's supervascular, has a 3-dimensional structure on the inside as well as supporting the outside. And they never even once thought to look inside and document the septal examination, turbinate examination, valve examination. None of this has been done. And so I understand that fillers and stuff is kind of, laissez-faire in our society, but it's not when there's complication. And now this patient has this giant septal perforation from a backflow of filler that went to an artery. And it's a sad thing. And it's really depressing for her because it should have been just just a filler, just liquid filler. It's not a big deal, but these things have consequences. So that's one. And the other thing that want to definitely say is I know a lot of people mix filler with, radiesse or sculpture or something to make it last longer. I will say I've seen some really terrible, terrible things done with that too when you do that in the nose, because the nose will kind of sometimes cement the radiesse against the nasal cartilages or bones. And when you're in there in surgery, it looks like literally cement has been glued to the nose, and it looks really bizarre, causes lots of scar tissue. So I would highly recommend patients, in my opinion, do natural fillers that are dissolvable. Hyaluronic acid is the only thing that should go in the nose. And then secondarily, really subtle amounts. If you're having to put a lot of filler in the nose, you should stop. You shouldn't that's not a liquid nose job candidate, in my opinion.
Yeah, I agree. And I don't think people really understand that when you put that filler in, especially in an area like the nose, it doesn't really dissolve. If it's gone, it's probably moved out, and you should be, if you keep filling it, it's like a bucket. It just, spills over. And so I love that story, man. That's terrible. And I think, it has its place. It has its limitations.
Of course. Yeah, but when done subtly and minimally, I love it. I think liquid nose jobs are phenomenal and the results are beautiful. And it's such instant gratification for the provider and the patient.
Absolutely, absolutely. So you treat a lot of celebrities. You're in LA. You work with Dr. Kanodia. So what is the most requested? Is if people come in and say, "I want so and so's nose." Do you have a most requested celebrity that people want to look like?
I'll say it definitely changed. I would say 5 to 10 years ago, it was definitely more celebrity focused. People would bring in pictures of someone very, very famous and want something very, or the Kardashian noses are always compared, of course, Kylie and Kendall's and Kim's. I would say more recently, I would say it's more social media influencers that are pictures are being brought in of. I don't think that it's I think the concept of celebrity has changed over the past 5 years in today's world. And I think a lot of social media influencers, I will say though, in my practice, because my practice is a little different from others, we do some of the biggest, I personally do some of the biggest, most famous human beings in the entire universe for their noses. And the reason they come to me is not because they want someone else's nose. They're coming to me because they genuinely want no one to know, super subtle, super minimal, just bring in the bones just a touch, just shave down the bump just a millimeter, make the tip just about 20% smaller, really subtle things. So my practice is a little different. I don't get like the classical, like, give me this person's nose job anymore. People do bring up like Beyonce, or they bring up like, some of the more traditional ones that people are like, did she or didn't she? Because no one really knows, right? It's something that's so secretive. And so to this day, who knows if Beyonce got a nose job or not, but her nose looks great, right? So it's one of those things. So those are more brought up to me versus traditionally where 5-10 years ago, I think people would bring a nose and say, hey, can you create this? I think that's kind of dying down in my practice, at least. But I will be honest, I think a lot of people today, because of how insanely available nose job before and afters are. I mean, every surgeon has 1,000 of them and they're all available on their website or Instagrams, right? So I think nowadays people come in with screenshots of other surgeons' work. That I see all the time. Yeah, they have the little screenshot folder, their little nose job folder, and they have literally screenshots from all different surgeons. And they just kind of want to make sure you understand the concept of what they're looking for.
Next week, we're back with Dr. Dugar for part 2 of our podcast. Find out if your noses really grow as we age. Plus, we'll reveal the one procedure you should never, ever have done to your sniffer.